Bob Harwood's my name. I'm a member of the Living with Books group in the library. The subject of my book is the journey as a carer when your patient is your spouse. And I've never been on this journey before, and this is the first time I've ever been a carer for my spouse, for my wife. And I am that because she got cancer. We were having a lovely life. We both had good jobs. Both wouldn't have given up our jobs. But when my wife got sick with cancer, she had to give up her job. And eventually I had to give up mine because I couldn't do both. So I thought I'd come and tell people about it, those that were interested to find out. My wife's condition is that she has a terminal cancer. It's going to eventually, it'll be what kills her or she dies of. She's got multiple myeloma, which means that it's a cancer in the blood and inside the bones. The way we discovered it was she had a sore back, and the back wouldn't stop being sore. And she had lots of examinations and lots of x-rays and those types of things. And eventually they found the crush factors in her spine. And then they realised that she had multiple myeloma, and then when they did some other tests, they found that it was definitely in. And what's happening there is that it's causing her to vomit. The treatment caused her to not be able to eat. She lost a lot of weight. She never ate for 3 months, and her health, general health, just went downhill. And I was there to feed her and to bathe her and to wash her and to clean her and to give her some standard of life. She's been in hospital, she's been in the hospice, she's been in a day surgery, she's been in emergency sections, and she goes down and we pick her up, and she's gone down and we picked her up, and it's been a major journey until recently we've discovered a drug that will actually attack the myeloma, and it's given back a lot of her ability to live a reasonable life. But she's been left with very little resilience, and sometimes she has to just lay on the couch all day, and other days she can get up and walk around for a couple of hours and then back to the couch again. I was a bit apprehensive about doing the Living Library in the first place, so I actually wrote up a 4-page document and I give that to the people that asked me to be their book. They read it and then they ask questions from it. And on this 4-page document, most of the common questions are answered, and therefore there is no common question because I've already covered it. And then it's their particular slant on, because everybody that's around us, they all have their cancer story. And they've all had the neighbour or their mother or their father or their brother or their sister or their friend that's had cancer, and they've all lived through, to some extent, already a journey on cancer. And therefore there is no common question that they ask me. I get out of this a feeling of other men that find themselves in my situation, and there's quite a lot out there in society, who have never been a carer for anybody. They've always had somebody being like a wife caring for them. All of a sudden are thrown in at the deep end. What do they do? How do they do this? So I thought I would set up a living book so that if they wanted to, they could come and talk to somebody and ask whatever question they wanted. There's a Living with Cancer project that's set up by the Cancer Council that's run in Bendigo, and some men of my age come to it, and I've been to some of those classes and lessons, and some of the questions that they ask at that would indicate that yes, they are struggling, whereas women are more easily able to adapt to that than what men are. But us men can get there. We've discovered that we actually are now closer together, and we've been married for nearly 40 years. We're closer together now than what we have ever been. Because in our early days, we had the children, we had 4 children, and if anybody's had 4 children, they know that's a full-time occupation for not just one but 2 of us. and therefore it's sort of like ships passing in the night. But now that, of course, the youngest is now 32, and we've now got time for each other, we're now actually able to have a more fulfilling relationship personally from one to one than what we ever had before. So cancer's not necessarily all bad. It's bad if you've got the pain, and it's bad if you've got the ill health, but other aspects of cancer, like the coming together and being together 24/7, that's a good thing.